வணக்கம், குட் மார்னிங். என் பெயர் டாக்டர் பிரபாகர். இன்னைக்கு வீடியோவில் பிப்ரவரி 2021 யூனிவர்சிட்டி எக்ஸாமில் 15 மார்க்காக கேட்ட எஸ்ஐ கொஸ்டினை பற்றி டிஸ்கஸ் பண்ண போகிறோம். கொஸ்டின் வந்து டிஸ்கிரைப் த ஆர்டீரியல் பிளட் ப்ரெஷர், டிஸ்கிரைப் த நர்வஸ் ரெகுலேஷன் ஆஃப் தி ஆர்டீரியல் பிளட் ப்ரெஷர். பிளட் ப்ரெஷர் வந்து தியரிட்டிக்கலாகவும் ப்ராக்டிக்கலாகவும் ஃபர்ஸ்ட் இயர் MBBSக்கு ரொம்ப இம்பார்ட்டன்ட் டாபிக். டாக்டர்ஸோட டே டு டே ப்ராக்டிஸ் லைஃப்பில் பிளட் ப்ரெஷர் வந்து ரொம்ப ரொம்ப இம்பார்ட்டன்ட். ஸோ நம்ம வந்து டீட்டெயிலாக எல்லாம் தெரிஞ்சிருக்கணும். வாங்க இப்போ நம்ம டாபிக் உள்ள போகலாம். Arterial blood pressure. Arterial blood pressure is the lateral pressure exerted by the flowing blood or the column of the blood on the walls of the vessels. Systolic blood pressure is the maximum arterial pressure during the cardiac cycle, or systole is the systolic blood pressure. Normal range is 100 to 139 millimeter mercury. More than 140 is hypertension. Systolic blood pressure mainly depends on the cardiac output. The systolic blood pressure fluctuates during the excitement, exercise, rest and sleep. Diastolic blood pressure is the minimum arterial blood pressure during the cardiac cycle, or diastolic blood pressure. Normal range is 60 to 89 millimeter mercury. The diastolic blood pressure mainly determined by the total peripheral resistance. The total peripheral resistance depends on the diameter of the blood vessels and viscosity of the blood. Pulse pressure is the difference between the systolic blood pressure and the diastolic blood pressure. So normal pulse pressure is 20 to 50 millimeter mercury. The pulse pressure important for the pulsatil nature of the blood flow in the vascular system. The hypertension, high pulse pressure indicate the decrease the elasticity of the vessel wall. The mean arterial pressure is the average blood pressure recorded during cardiac cycle. It is called as the mean arterial blood pressure. Mean arterial pressure calculated by diastolic blood pressure plus 1/3 of the pulse pressure. Because the diastole duration is more than systole, it is 0.5 seconds compared to the systole 0.3 seconds. So normal value of the mean arterial blood pressure is 75 to 105 millimeter mercury. Mean arterial blood pressure is important for the forward movement of the blood in the lumen of the blood vessels. Nervous regulation of the arterial blood pressure is powerful, acting immediately, short-term regulation of arterial blood pressure. They gradually lost their ability with time because of adaptation of receptors. So in the nervous regulation, we are going to discuss the autonomic regulation. Under the control of autonomic regulation, we go to discuss the sympathetic innervation and parasympathetic innervation. And medullary control. Under the medullary control, we go to discuss the vasomotor center, role of nucleus tractus solitarius, role of cardiac inhibitory area, and hypothalamic control we go to discuss, and role of cortical control on the blood pressure. And reflex regulation, we go to discuss about the baroreceptor reflex, hemoreceptor reflex, Cns Ischemic Response, and Cushing reflex. Abnormal reflexes like Bejald-Jaris reflex, Painbridge reflex also we have to discuss. This is the important university question, nervous regulation of the arterial blood pressure. Autonomic control of blood pressure. Sympathetic vasoconstrictor system originates from intermediolateral gray column of spinal cord. The postganglionic fibers innervate blood vessels and heart, and preganglionic fibers terminate in the adrenal medulla. It increases the blood pressure. Sympathetic vasodilator system, these fibers supplying arteries and arterioles of the skeletal muscles produce vasodilatation as they are innervated by sympathetic cholinergic fibers. Parasympathetic control the systemic vessels not supplied by the parasympathetic fibers, but vagal stimulation decreases the blood pressure by decreasing heart rate and cardiac output. The vasomotor center areas diagram. The vasomotor center made up of group of neurons. It's having the two important areas. The pressure area situated bilaterally in the anterolateral portion of the upper half of medulla. The depressor area situated bilaterally in the anterolateral portion of the lower half of the medulla. The depressor area receives the impulse from the nucleus tractus solitarius. Nucleus tractus solitarius sends the excitatory glutaminergic impulse to the depressor area. The depressor area sends the impulse to the pressure area that releases the GABA inhibitory neurotransmitter. So the depressor area inhibits the pressure area. So normally pressure area always release the tone to maintain the sympathetic vasoconstrictor fibers, spontaneously transmit the impulse to the sympathetic vasoconstrictor fibers. So it maintains the partial state of contraction of the blood vessel, that is called as the vasomotor tone. So it is important for the maintaining the blood pressure that is inhibited by the depressor area. Okay. So when the blood pressure is high, so baroreceptor is stimulated, that sends the impulse from the nucleus tractus to the depressor area. The glutaminergic neurons send the impulse to the depressor area. The depressor area sends the GABA to the pressure area. It decreases the blood pressure. So this is the connections. Nucleus tractus solitarius projections. The excitatory glutaminergic projection of the nucleus tractus solitarius terminate to the depressor area of the vasomotor center. Okay. The depressor area of the vasomotor center releases the GABA inhibitory neurotransmitter to the pressure area, so it inhibits the sympathetic activity. Pressure area of the vasomotor center connected with the spinal cord through the sympathetic neuron. So this is the one connections. Nucleus tractus solitarius releases the glutaminergic secretions that stimulate the depressor area. Depressor area controls the pressure area. It inhibits the sympathetic activity. Another one connection is the nucleus tractus solitarius sends the impulse to the cardiac vagal center, that is called as the nucleus ambiguous. So nucleus ambiguous is the cardiac vagal center. It inhibits the heart through the vagus. So whenever the blood pressure is increases, this activity will occur. Cortical control of blood pressure. Cerebral cortex area 13 concerned with the emotional reactions. So during the emotional conditions like fear, anger, stressful conditions, the vasomotor center is activated, vasomotor tone is increased and the blood pressure increases. Hypothalamic control of blood pressure. Stimulation of the posterior and lateral nuclei of the hypothalamus causes vasoconstriction and increase the blood pressure. And stimulation of the preoptic and anterior nuclei of the hypothalamus causes vasodilatation and decrease the blood pressure. The impulses from hypothalamus are mediated via vasomotor center. Baroreceptor location and innervation. So baroreceptor in the blood vessels located in the two places. One is aortic arch baroreceptor. That is send the afferent through the vagus nerve to the nucleus tractus solitarius. Another one is the carotid sinus baroreceptors. It is located in the bifurcation of the internal carotid artery from the external carotid artery. So it is located in the internal carotid artery. The afferent is carried by the carotid sinus nerve. This is the branch of the glossopharyngeal nerve, 9th cranial nerve. Vagus nerve is the 10th cranial nerve. Baroreceptor reflex or sino-aortic reflex. The high blood pressure is sensed by the baroreceptors located in the carotid sinus and aortic arch. From the carotid sinus carries to the nucleus tractus solitarius by the sinus nerve, branch of the glossopharyngeal nerve. From the aortic arch carries by the aortic nerve, branch of the vagus nerve. From the nucleus tractus solitarius, excitatory glutaminergic fibers send the impulse to the depressor area of the vasomotor center. Depressor area releases the inhibitory neurotransmitter GABA to the pressor area of the vasomotor center. The pressor area of the vasomotor center is important for the maintaining the blood pressure during the rest. It is increases the sympathetic vasoconstrictor activity. So it always maintaining the blood pressure. So depressor area inhibit the pressor area of the vasomotor center. It decreases the blood pressure. So another one way, nucleus tractus solitarius send the impulse to the cardiac inhibitory area, that is nucleus ambiguous, otherwise called as the medullary parasympathetic area, that decreases the vagal tone. So it decreases the heart rate. Suppose when the blood pressure is decreased, the carotid sinus and aortic arch not stimulated, so the pressor area of the vasomotor center is stimulated, so it increases the blood pressure. So in the high blood pressure, vasomotor center is inhibited. Baroreceptor function is inhibit the pressor area of the vasomotor center. So in the high blood pressure it will decreases. When the low blood pressure, it is increases the blood pressure. So baroreceptor reflex is the first and foremost reflex for regulating the blood pressure. It operates within the few seconds. It is essential, life-saving in day-to-day activities. Normally the blood pressure falls by about 30% on standing from the lying posture, which is immediately corrected by the baroreceptor reflex. The baroreceptor reflex regulates the blood pressure within the range from the 50 to 200 millimeter mercury. So in the answer you have to write these points in the written format, the descriptive format in the theory. Chemoreceptor reflex. Receptor for the chemoreceptors are carotid body and aortic body. Carotid body are the notch-like structure, 1 to 2 millimeter size. It has a high blood flow. So it is stimulated by the lack of oxygen, excess amount of the carbon dioxide, and increased hydrogen ion concentration. From the carotid body, impulses are carried by the glossopharyngeal nerve. From the aortic body, it is carried by the vagus nerve. The main function of the chemoreceptor reflex is the regulation of the respiration. Chemoreceptor reflex also stimulates the vasomotor center, pressure area of the vasomotor center. So it increases the blood pressure. So it activated when the blood pressure is fall below the 70 millimeter mercury. Fall below the 40 to 70 millimeter range of the chemoreceptor is the reflex is the 40 to 70 millimeter mercury. When the blood pressure falls less than 70, it is activated. It prevents the further falling of the blood pressure. So these are the functions of the chemoreceptor reflex. So you have to draw the diagram and you have to write these points. So it is also produce the bradycardia. The primary reflexes are vasoconstriction, hyperventilation and bradycardia. Later it will produce a mild tachycardia. So in the respiratory system also you can elaborately study about the chemoreceptor reflex. Cns Ischemic Response. When the blood pressure falls below 40 millimeter mercury, the blood flow to the vasomotor center is decreased. The accumulation of the carbon dioxide is increased locally near the vasomotor center in the medulla. The accumulation of the carbon dioxide in the vasomotor center stimulates the vasomotor center of the pressure area. It stimulates sympathetic vasoconstrictor fibers. It leading to the increases the blood pressure. So it is called as the last stitch stand pressure control mechanism. That is the emergency pressure control mechanism saving the brain. So if the blood pressure does not relieve the compression or blood flow, decrease blood flow to the brain, it will produce the severe irreversible damage to the neurons within the 3 to 10 minutes. So this is a very important life-saving mechanism from the irreversible coma. Cushing reaction. When the CSF pressure rises and becomes equal to the arterial blood pressure, it compresses the arteries in the brain and stops the blood supply to the brain. This initiates the Cns Ischemic Response. This causes rise in the blood pressure. When blood pressure becomes greater than CSF pressure, blood flow through the vessels of the brain occur and ischemia is relieved. This effect is called as the Cushing reaction. It protects the vital center in the brain. This also happens in the brain tumor also. Coronary hemoreflex or Peugeot-Saris reflex. Coronary chemoreceptors are present in the coronary arteries and ventricles or C fiber endings. The afferent from the chemoreceptors are vagal fibers. Injections of chemicals like capsaicin, it is derived from the capsicum, and veratridine. It is the alkaloid derived from the lily plant. It opens the sodium channel. And vinyl diquinide and serotonin into the left coronary artery produces hyperventilation, bradycardia and hypotension. So this is called the coronary hemoreflex or Peugeot-Jaris reflex. So it stimulates the C fiber endings located in the coronary arteries and ventricles. In myocardial infarction, infarcted tissue stimulates the ventricular chemoreceptors and produces the bradycardia and hypotension. Pain bridge reflex. Pain bridge reflex is the infusion of saline or transfusion of blood produces tachycardia if the initial heart rate is low. It is called as the pain bridge reflex. This reflex described by Bainbridge in 1915. The receptors are tachycardia producing atrial receptor located in the atrial wall where vena cavas open into the atria at mainly veno-atrial junction. This reflex is mediated by the vagus nerve. So the reflex is abolished following vagotomy. Summary. Describe the arterial blood pressure and the nervous regulation of the arterial blood pressure is the important long question. This is a vast topic. So brief we are discussed here. So in the discussion we are not discussed what are the factors affecting the arterial blood pressure. So it will take another 10 minutes. So this much is enough for getting the good marks. But you should read the textbooks. That is very, very important. This is for getting the concept, some concept about this blood pressure. So you should read the textbook. Thank you for watching this video. If you like this video, subscribe and share your friends. Thank you once again.